Hi guys, if you're wondering who is this imposter wearing a pink wig pretending to be Xiaxue, it's actually still me, just without makeup. Okay, and if you're thinking why are you freaking us out like that, it's because today I'm actually going to be doing plastic surgery, so I cannot put any makeup on. And yeah, today I'm actually going to be doing an eyelid revision and a nose revision. I think when I tell people that I want to do this surgery, they always tell me I'm crazy, that I look fine, but I think it's because I'm really good with applying makeup. So with makeup, like a lot of these flaws cannot really be seen because there's a lot of things going on with my face. I know how I look like without makeup, and I would like to, go out in public and just, kind of be happy with my face instead of feeling that people might see all these flaws, I guess. So if I can just kind of fix it again, I would. And I just want to make it clear, today's surgery, I'm actually paying for it. So this is not like a sponsored advertisement or anything like that. But I know you guys are very interested in plastic surgery, so Dr. Huang has actually kindly agreed to let us film inside the theatre, so you will actually get to see how the surgery is done. So yeah, you guys are in for a journey. I've changed into my scrubs, so there you go. Very ugly. So I'm going into the room now to do what is called markings, where I guess Dr. Huang will be like, drawing on my face to see where he wants to cut later. And also I'm supposed to take some before shots. I'm actually very excited to go under, so because like the twilight anesthesia, it feels very good, like it's very nice. It's very happy to be nice legal drug to have. Hopefully I wake up looking better, I guess. Am I being sedated now?
Yeah.
Oh my god, how come I'm still so awake? C, A, B, C, D. Oh my god, I cannot already. Oh no. Okay, bye world. So I know you guys are like thinking, what the fuck, like haven't you done like your freaking nose like 2 times and your eyes like 2 times, and now you're going for the third? So yes, today I am, and I'll explain to you guys why. For my nose, I actually did my nose twice already, and both times I actually did it with Dr. Martin Huang, and I'm very happy with how my nose turned out, because if you look at my old photos, you would see that my nose was just really very bulbous, very flat, very big, and very lumpy. So basically, a lot of people have told me that they really like my nose job. The only thing that I'm a little bit not very happy with is the columella still has kind of a scar. So you can kind of see that there's a bit of an indentation here where Dr. Huang has actually had to open the nose to do the surgery. It's not very obvious. I think if it's a sort of a 3/4 view like that, you can kind of see how there is an indentation that goes in here. But to me, if I'm just going to be going under to do my eyes anyway, I may as well fix this as well. So it's just something that's a little bit bothering me. So today I guess I would like to sort of smoothen out that indentation. And how it's going to be done is that I'm going to harvest this ear cartilage and put one inside here as another implant, I guess, a columella implant, which I've never heard of anyone else doing, but Dr. Huang is doing my surgery today and he says that he's confident in doing it, so okay. Okay, so I am being sedated now and I have completely gone under, so I have no idea what's going on. If you are wondering why there's a picture of me here, Dr. Huang has explained that he always puts a picture of his patient so that he can constantly refer to the picture and look at the front, the side, the below, etc., all the ways that he wants to change it, and it also acts as a checklist for him. So what's happening right now is that Dr. Huang is actually injecting some local anesthesia into my nose, and this will make sure that my nose is pain-free when I do wake up, even though I'm unconscious right now. So he's commencing with the cutting of the columella, and you can see here that it is already open. And if you're wondering what are these 2 pieces of white paper, they're actually called patties, and they have little wires attached to them as a fail-safe in case they fall into your nose. But the patties are actually used to soak up blood and fluid so that it won't flow down your throat during the surgery. So he's making his incision. Now you can see that the columella is open, and this will let him put in my columella implant and my tip implant. So what you're looking at right now is my ear, and Dr. Huang actually decided on my left ear because he said that the cartilage area for that ear is a little bit bigger. He's actually using a marker to draw a line along the rim so that he knows precisely where to make his cut. And just like that, the cartilage is taken out. He actually took out a pretty big piece of cartilage, and this part of the surgery actually took a pretty long time because using the cartilage, he actually fashioned it into 4 different pieces to put into my nose. I might be the person in the world with the most amount of things in her nose. Yes, so you can see right now that he's testing the fit and modifying the cartilage with very, very precise little cuts so that it will be perfect for the nose. So here he is modifying it again, and even though the surgery, I wanted it to kind of reduce the indentation on my columella, we both actually agreed that my nose will actually benefit from some additional projection and definition. So he actually put in a big piece of cartilage at the tip so that the tip will be a little bit more defined and more pointy. So after a few hours, Dr. Huang actually sewed up the wound and my nose is done. So I actually did my eyes back in 2015 in Malaysia, and the surgery is not done by Dr. Martin Huang. And what I did was an incision for double eyelid surgery to make it deeper and more permanent, and also epicantoplasty, which is the opening of the inner eye corner to make your eyelids more parallel. I guess like the surgery didn't heal that well. Like I'm quite pleased with how it turned out actually, but there are still some parts that I'm not very happy with. The eyelid area, it's not smooth here. There is almost like a little ridge, and then it's like these little white patches that are kind of lumpy at the inner corner. It's not the surgeon's fault, because if you can look at the incision scars, you can kind of see them, and it kind of ends here. Like there's a line that's quite obvious that it ends here. So the double eyelid is supposed to be like that, like parallel to how my eyes are. But instead it kind of tapers in and joins almost, and that kind of makes the eyes look kind of really like old, I guess, and that's not what I wanted. But I think because the skin was too like saggy, or maybe the muscles not tight enough, then even though the incision was here, the line is still here. Yeah, so that's one of the things I don't really like. Today I'm also going to do a ptosis surgery. Ptosis surgery is actually to lift up the muscle in your eyelids so that it doesn't sag so much. So when you look at my eyes, you can actually see that the eyes, like the iris, a lot of it is covered by eyelid, because probably the muscle there is not strong enough to pull it up, so it just looks like it's a bit sleepy all the time, so it covers a lot of my iris. And also he has personally said that he thinks that the line is a little bit too deep and it kind of looks a bit artificial, so to sort of lessen that out a little bit too. So here you can see that Dr. Huang is working on the medial epicantoplasty, which is the opening of the inner eye corner, and he's making his incision. I guess some of you may be asking, you know, if you had a previous eyelid incision, then can it be changed? Like, would it go to the new crease instead of the old crease? And the answer is actually yes. Your crease position can be changed. It's because the crease is actually created by putting stitches in place. So as long as you remove the old stitches and sort of loosen and disrupt the old stitches, and you put new stitches in place, then it will hold up the new crease. Okay, so right now Dr. Huang is actually making very precise cuts to my double eyelid and opening it up. It's a little bit gross. Actually, during my double eyelid surgery, I was awake and kind of conscious. I felt no pain whatsoever, of course, but I was aware of what is going on in a very goggy manner. So even though it looks like it's very painful, I'm not in any pain or any distress. Okay, warning, this part is gonna get super disgusting and graphic. Alright, so this white color thing that you see is actually the ptosis repair that's going on. So right now he's actually doing a ptosis repair, and he's stitching my eyelid muscle to my eyelid cartilage. Yes, there is actually eyelid cartilage, so it's something you learned today. And ptosis repair will actually enable you to open your eyes bigger, so that's what he's doing right now. I would also love to point out that at this point you can see that there's a very nice little profile of my new nose. Oh my god, I'm in love with it. It's so cute. So he's checking my eyes right now, asking me to open it big, and so that he can see where the crease goes. And so right now Dr. Huang is actually checking the ptosis repair and making sure that the eyes are symmetrical. Now he's doing ptosis repair on the other side of the eye, and even though at this point he's actually done with the epicantoplasty, he's actually not done with the crease yet. And Dr. Huang is pushing down my forehead to ask me to open my eyes, to kind of make sure that I'm not using the forehead muscle to yank open my eyes. So he's just making sure everything looks perfect. So after Dr. Huang has stitched up my eyelids, my eyes are actually done, and right now he's actually doing a final check on my nose to apply some tapes on the nose, and the tape will actually help to stabilize the cartilage and reduce swelling. All in all, the surgery took about 9 hours. 9 freaking hours. And this whole time, he did not go to the toilet or eat. Yeah, and I'm feeling very groggy right now. My eyes feel very swollen. I can't really open it, but I'm not in pain. Just kind of really groggy and sleepy, I guess, and no energy. Yeah. But you know what? When I was going under and everything, my shoulder aches stopped for a bit, so that was nice. Fuck, my shoulder aches are back. The nose feels a lot more comfortable than the eyes, almost like nothing was done to it, so I don't feel anything on my nose at all. But the eyes, I can tell that it's swollen, although it's not painful. And the right eye is significantly drier than the left for some reason. So that's causing me a little bit of discomfort, as in that it keeps tearing and being wet. But other than that, everything is fine. Oh, my ear. Yes. My ear feels nothing. Cannot feel anything on the ear. From here, it will take about a week before stitches come off. That's what I told. And then after that, it will slowly deswell. But of course, as Dr. Huang would say, the most optimal period after probably, I don't know, months and months later, where it's completely not swollen lah. But I think maybe after a month or after 3 weeks, you can kind of like 去见人 and not be scary, you know? Yeah. I'm feeling really hungry right now. Kind of want to eat, but I wouldn't be able to tell what I'm eating, so I hope my mom had the sense to go and buy food for me. Alright, so we've come to the end of the episode, and I guess if you want to see how I recover and how the end result looks like, I'm going to be vlogging my whole recovery journey on my own channel. So don't forget to subscribe there if you want to see how this turns out, I guess. And as usual, of course, subscribe to Clicknetwork as well and download our apps. Thank you for staying with me through this. I love you guys. Bye. Better don't smile. Yes, it just burst. Huh? I look like that only, so normal. Nice. What about my ear? Can I sleep on my ear? I cannot, right?
Try not to.
Oh shit. My poor ear. Oh, ouch.